Hello, everyone. I'm trying to start right on time because I know there's a really important Red Sox game on later tonight. So I know you all want to get home. You'll be home long before that starts, so no worries there. Welcome to York Hospital. Please know there's water and cookies outside in the hallway. You probably walked right by them. If you need something to eat or drink, feel free to go up and grab something. Please turn off your cell phones or turn them on to vibrate. You might have seen the cameras in the back of the room. We're videotaping this because this room is not big enough for everybody that we wanted to invite, and we want to put this out on our website for people to be able to see. I'm Dawn Fernald from the Friend-Raising Office at York Hospital. And one of the things the Friend-Raising Office, and I did not say fundraising, I said friend-raising. One of the things we do here is we bring community education to you. So we are here tonight with some folks from Maine Community Health Options. Does anybody in the room know what Maine Community Health Options is? Good, I see some head shaking, that's great. Today's topic, the health insurance marketplace and this new insurance company. So today we have the pleasure of having Maine Community Health Options CEO Kevin Lewis here to share some information. He's going to come up here in a minute, but I also wanted to introduce some of his other team members here in the back of the room. You might have seen some suits back there. Yes, so we have Beth O'Hara-Miklovic, who's the Outreach and Education Specialist back there. Raise her hand. And then we have Chief Operating Officer Rob Hillman back there. And then Director of Business Development Scott Tattersall back there as well. So I'm just going to get out of your way. I'm going to bring Kevin right up here to get right into this. So thank you all for coming.
Thanks so much, Don.
And then at the end of this, just one other thing. Questions, we're going to have this microphone to bring around the room. If you have a question, I want you to use this microphone. If you could, we'll bring it to you. Okay, thanks.
Super. Don, thank you very much. It's really a pleasure. Thank you to all of you for coming out to explore what we have to offer. We're really proud of our ability to come into the marketplace and provide. So thanks to Mr. Judd Knox, obviously, for making this opportunity for us to be able to present what we have to offer to Maine people. So what I'd like to cover today is how we came into being, what our mission and vision is, what our approach is as a nonprofit, member-led insurance company. And then talk about our network, which covers the entire state. Some of our benefit design features that I think everyone who's looking for coverage should know of. And then talk about our availability both on the marketplace, on the exchange as it is, and as well as off the exchange. And some of our outreach efforts and you know, how you can participate in that. But really look forward to a rich conversation at the end here. So hold your questions, but we do want to get into a good conversation that Rob, Scott, and Beth and I can all participate in here. So our mission and vision, we created the insurance company, Maine Community Health Options, really to partner and to provide a partnership approach with providers, with businesses, with Maine people, in order to provide affordable and high-quality benefits. And we have, you know, both affordable and high quality to promote health and well-being. And I notice around the campus here, there's a very conscious choice of words in terms of well-being, and we also struck on that as important. And so it's one thing to have good health. But it's another thing to truly feel that one has well-being in one's life. In terms of our vision, we are committed to being a leader in transforming the health of Maine people and positively affecting the Maine economy. We got into this work to truly be different, and that difference has to be measured by lowering the total cost of care so that people can afford coverage, so that businesses don't have to worry about where that coverage, how much that coverage will cost them, and whether they'll be able to sustain benefits for their employees. And so one of the hallmarks of Maine Community Health Options is we're a nonprofit. And it's been more than a decade since there was a nonprofit health insurer domiciled here in the state. And so we are a return in many ways of what used to exist in Maine in terms of Blue Cross Blue Shield, but not only are we nonprofit, we're also member-led. And we are locally based. We have our headquarters in Lewiston. We're really proud to have all of our operations based out of Lewiston in terms of our call center. We have our member service associates answering phones. We're very proud of our statistics and our ability to provide service for everyone in the state out of our Lewiston Operations Center. Provider relations is critical as well. And we have a great team of provider relations spanning the state, working with hospitals, medical offices, providers of all types. And just for you to understand and know that as we get into coverage behind the scenes, we are working closely with providers to make sure that there are, to the extent that we can make sure there are no gaps in coverage, that there are no gaps of information. We really approach this as working hand in glove with both our members and with providers to make sure that people have access to the full range of their benefits and full access to the range of care and services they need to stay well. And that gets into the medical necessity decisions as well. So that's all locally driven. We have a chief medical officer who has dedicated his life to care in Maine. He presently continues work as a primary care provider at a community health center in central Maine. And he does that 1 day a week, and the rest of the time he dedicates to his role as Chief Medical Officer for Maine Community Health Options. He's got a great team of clinical staff, including a nurse practitioner who recently worked at Bath Iron Works and also led the wellness initiatives when she was at Maine Medical Center, employee wellness. In terms of care management and quality, that also speaks to the partnership approach that we look at with providers and with our members. So rather than having a call center based someplace else in the country or someplace else in the world that is generating care management decisions, care management we find is most effective when it's local. And so we want to be able to support that relationship which exists between the patient and his or her primary care team. And where necessary, we will be making those outreach calls as well, engaging with providers and engaging with members, but doing so in a way that supports that relationship between the patient and the clinician. And in terms of some of these hallmarks, I'd last point to a really important feature for us, which is integration of behavioral health in primary care, integration of behavioral health and medical care in general. And so rather than outsourcing to some other company, we look at it as insourcing, where we've brought on a partner that specializes and has a great deal of expertise in behavioral health. They have staff co-located with us to support our benefit design, which we'll talk about in just a moment, but to assure that people have access to the full range of behavioral health services on par with medical services. So we truly are living the parity, the level of parity that's expected of coverage today. I talked a little bit about our some of those hallmarks, and here we have a statewide network of medical and behavioral health providers. So already we have every single hospital in the state that's part of our network. We're very proud of that. We think that care is local, that access to coverage is essential, but access to coverage is essential when it leads to access to care. We want to make sure that the benefits translate to people getting the care that they need in order to then result in better health outcomes. If you think about it, there are some, in terms of health reform, access to coverage is just one part of it. We have to be able to reduce the total cost of care, and the only way we can do that is by improving the health of the population. Any other way we look at it, it's pushing on one end of the balloon and it's going to pop out on the other side. So instead of trying to ratchet down on rates or push more costs on the consumer, which are the only other two options, really what we need to do is work together to increase the population health and thereby reduce the total costs of care. We can do it by also eliminating waste, and so we're intent, you'll see that in terms of our model as a nonprofit. Already we're reducing some of that waste and reducing some of the allocation of resources to out-of-state shareholders. In our partnership model, we first point to providers. For us, it includes the full range of providers, as noted here, and we have no requirement for referrals for a specialist. We are a PPO plan. But we do look to have close coordination with the primary care provider. So we are seeking a selection of a PCP, and where no selection is made, we will make an assignment, and then if that doesn't fit well with the member, we will make adjustments. But we do want to have that connection with the PCP and the medical home. So we talked about the importance of local care management, integrated behavioral medical health, and really member engagement. So we look at this as the coverage is to support the members' engagement in their own care. You may have heard of Choosing Wisely. This is a great effort out of the medical field itself. Providers have volunteered and come up with a list of treatments that are actually not advisable and things that people ought to be very wary of and know about and make wise decisions going in. There are other conditions where we want to make sure that consumers know of their choices so that people have those informed conversations with providers. It's a very different world than in certainly years ago, where it's a very top-down, didactic type of approach where we took the advice of our physician without any question. And I want to talk briefly about our value-based insurance design, which is meant to encourage the most effective medical treatments and bring costs down. So again, it's the emphasis on early entry to care, on ensuring that people have access to the kinds of treatment that's going to result in the best outcomes. And so what we've done is begin our chronic illness support program with a focus on 4 conditions: asthma, diabetes, hypertension, and COPD, chronic obstructive pulmonary disease. These have high prevalence in the state of Maine, and there's obviously a lot we can do to prevent the worst outcomes related to these conditions. But these conditions also require oftentimes out-of-pocket expenses on the part of the member, the patient, that can get in the way of accessing the very care necessary to stay on the right side of the disease. So what we've done is lower the out-of-pocket costs, whether it's for office visits, generic drugs, DME, or lab services, to 0 for people that have these conditions as it relates to the management of these diseases. The intention, of course, is to take that financial barrier away so that people are able to access the care they need. So not only is it generic drugs, it's also, we cut in half for brand name drugs that are preferred brand drugs. We cut in half the copay. So if there's a $30 copay, it gets cut in half to $15. $50 copay would be cut in half to $25. 50%, cut in half to 25% coinsurance, along those lines.